Bismillahirrahmanirrahim. Assalamu alaikum. Hello everyone. I'm Dr.
Walaikum Assalam.
I'm Dr. Sahar Aslam. I'm a specialist family medicine with MCPS Family Medicine and MRCGP International. Thank you for joining us this evening. Okay, before we start, I would like everyone to type two things in the chat box. One is from where you are appearing, or from which country you are attending this session. And the second is whether this is your first OSCE or a repeat attempt. Okay, I will give you a few seconds so that you can write down this in your chat box, please. Yes, just write these two things in your chat box and your country and whether this is your first OSCE attempt or a repeat attempt. All right, great. Okay, welcome from Pakistan and Sri Lanka, Bangladesh, UAE, and elsewhere. Welcome, everyone. All right. Let me start with a simple question from all of you. How many doctors, how many doctors here know colleagues who have passed their AKT very easily or in first attempt comfortably, but later they struggled in the OSCE? Most of you must know such colleagues who have cleared their AKT in first attempt, but they are struggling with the OSCE attempt. Maybe they couldn't make it in even in two attempts, and they are and it would be their uh, third attempt. Okay, so the reality is passing AKT does not guarantee success in OSCE. Okay, AKT is primarily a knowledge test, and OSCE is your performance test. In your AKT, all of you have been checked or judged on knowledge basis. Okay. Now in OSCE, you will be judged for your performance. Okay. The examiner is not simply assessing whether you know the diagnosis. Okay. They are not interested in that. You know the diagnosis or how much DDs you are having in your mind. They are not interested in that. Okay. Actually, they are assessing how well you communicate, how you structure a consultation, and how you explore concerns. And of course, how you explain the management and safety net the patient. Okay. So over the next 60 minutes or 1 hour or so, I just want to show you exactly what the examiner is looking for and where candidates commonly lose marks and how structured practice and feedback can improve your performance. Okay, and most importantly, we are not we won't just talk about the OSCE. We will, in fact, run a live mock station together, and I will try to debrief it using the same communication domains that determines whether a candidate passes or fail. Okay, so by the end of this session, you all should have much clearer idea of whether you currently stand where you currently stand and what you need to work on before your examination, before your OSCE exam. Okay, so before going further, let me briefly show you what we will cover in this session today. Okay, first we will discuss why candidates who pass the AKT still struggle in the OSCE and what the examiner is actually looking for. And then we will look at the most common reason candidates lose marks, even when the clinical knowledge is very strong. Okay. And after that, we will run a live mock station and I'll debrief it using the same communication skills which is required for your exam. Okay, then I will show you how our 20 weeks structured OSCE program is organized and what candidates receive throughout the course. Okay, and then we will be having a time for questions and I will explain how to enroll for the PGIFM November badge. Okay, so I shall try to keep this session practical, interactive, and focused on what helps candidates pass. Okay, so let's start with a reality check. All right. Let me ask a question. How many of you have prepared AKT by reading guidelines or solving MCQs, recalls, and struggling alone? I think most of us did. Okay. And that approach works for AKT. Somehow it works for AKT because AKT is fundamentally a knowledge examination. If you know the answer, you score the marks. Is that so? But OSCE is completely different. In OSCE, the examiner is not sitting there and thinking, does this doctor know the diagnosis? Or how many DDs he is going to evaluate or rule out how many DDs? No. He is watching every second of the consultation and they are observing how you open the consultation, whether you build rapport or not, whether you explore the patient concern, whether you explain management clearly, whether you involve the patient in decision making or not, whether you safety net properly. Okay, so in other words, AKT tests what you know, but OSCE tests what you do. Okay, a candidate can know correct diagnosis and still they fail the station. And equally, a candidate may not reach the perfect diagnosis, but still score high because they demonstrated everything very well. Their consultation is very strong. They safety net the patient. Their approach is patient centered. Okay, so this is why many doctors pass AKT comfortably and are shocked when they struggle in OSCE. And they continue preparing as if it is a knowledge examination. It isn't. Okay, I have seen many candidates preparing OSCE with all those recalls and all those topics and recalling all those PDFs and notes they have made. No, it's not your knowledge exam. You have been through your knowledge exam and you have cleared that. Now this is your performance exam. You have to show how safe GP you are. Okay, what are your communication skills? How well you handle the patient and the situation which you have been tasked when you will be in your OSCE. Okay, so it is a communication and consultation performance examination. So if clinical knowledge alone isn't enough, what exactly is the examiner marking? This question rises in each of us in our mind. Okay, let's look in the next slide. Okay, so if you remember one slide tonight, let it be this one. Okay, most candidates prepare for OSCE by studying diseases and lecture notes and all those things, but examiner don't want that thing from you. Everything you do in OSCE station will usually fall into one of these domains. Okay, so first of all, initiating the session. Okay, in this part of your OSCE, or you can say when you are performing your OSCE station, in this part, you have to introduce yourself. We also call it as facilitation part. Okay, so you have to introduce yourself. You have to build a good rapport in front of patient by entering and keeping a smile on your face, not a tensed face. Okay, you have to establish the agenda. You have to let the patient or SP, which is a surrogate patient or a simulated patient. Okay, you have to let him speak for at least 60 seconds to 1 or 2 minutes or a couple of minutes, or at least for 1 minute. Okay, and this is very important part. In this, all of you will judge the diagnosis. Okay, in this session, if you have to listen very actively. You have to be a good listener at that time, and you don't need to interrupt the patient, because this is highly important session. In this, you will make the diagnosis. In this session, you will start your brain processing what question I have to derive from the patient, what things I have to ask, and how I have to take this station further. Okay, so this is very important. Okay, then gathering information. This is where many doctors focus all their energy, and they take a beautiful history, but they never ask, what are your thoughts? What concerns you most? Okay, and what were you hoping I could do for you today? ICE framework: ideas, concern, and expectation. It is not about just taking history like a house officer or an undergrad level. No, you have to judge. You are a family physician. You have to give a holistic approach to the patient. You have to ask the patient what is his idea, what he thinks that it could might be hurting her, what he thinks that it could might be the reason of her pain or his pain, if he is coming with a knee pain or anything else. And is there anything specific which is bothering her or him? Okay, that is concern. What concerns you? What concerns you most? You can ask like this. And expectation: what are you hoping from today's consultation? Or what are you hoping from me that I could do for you? You sometimes in some communication, or you can say in such counseling station, you have to ask the expectations as well. It is not just about taking every part and every step of history of, okay, that's important too, but here these ICE framework, if you miss this, you will lose marks. Okay, then examination and clinical reasoning. And this isn't about performing every examination. Head to toe, you are going to perform and you are wasting your all the minutes on it. No, you will be provided only 10 minutes for your station. In those 10 minutes, you have to reach all these 6 boxes. Okay, so examination should be very focused, very relevant, and you have to read your task very carefully. Sometimes, in fact, most of the time, they used to write that examination is not required, and then still the candidates are wasting time on the examination. Okay, so this is very important. You have to do a very focused examination. If somebody is coming with cough, you have to listen. You, after doing general physical examination, you have to listen the chest and do the relevant chest examination. There is no need to go to abdomen, and there is no need to do CVS and all that. Okay, you have to be very focused and very quick. Then next is explanation and planning. And this is where many candidates becomes a lecturer. They give a 3-minute speech to the patient or to SP. Okay, but your examiner wants a conversation from you, not a lecture from you. Okay, you have to explain. You have then pause, check the understanding of the patient. You have to ask such questions. Are you with me? Does it sound good to you? Okay. Are you getting my point? These are the, these are the pause, and you these are the this is the thing that is, you are checking the understanding of the patient. You are involving the patient with you. Okay. And it is a shared decision making, not a lecture from you. An examiner is not interested in your lecture. Then there comes the closing the session. And this is where one of the most commonly missed domain, either the time is finished, you couldn't sum up at the end. Okay, and you either you are stuck in the examination and your time gets over, you wasted so much time in taking a very long history, or you have wasted so much time in explaining each and everything which is unnecessary to explain. You have to be very summarized here. Okay, summarize the history, and then you have to move on immediately. And then one of the most commonly missed domain, in fact, and then candidate prescribe medications and stop. No follow plan given to the patient, no safety netting given to the patient, no red flags highlighted, and you are sitting like you have done everything. Okay, so you have to wrap up the station in a very good way. You have to tell the safety netting, you have to tell the follow-up plan, whether the patient is agree with your management plan or not. Okay. And 6 is building the relationship. This domain is, this is different. It is not assessed at the beginning. It is not assessed at the end. It is assessed throughout the entire consultation. Okay, by you will be judged by the examiner that how respectful you are to the patient. Are you empathizing their suffering? Are you acknowledging their suffering or not? Are you an active listener or just interrupting in between? Okay, so this will be judged throughout your station.
अभी ये नीचे वाला ले जाओ ना ऊपर जाओ.
Okay, and these marks are being earned or lost every minute. Notice something interesting, but notice something interesting and strong medical knowledge is important, but medical knowledge alone is not enough to pass OSCE. That's why candidates can know the diagnosis and still fail the station. Okay, in OSCE, you will be provided only 10 minutes and the task will be written on the outside of your station and you have to read it and the bell will ring and you have to enter into the station. And this rehearsal we will be going in further weeks in our sessions. Okay. So if these are the domains being assessed, then where candidates most commonly lose marks? Let's look into the next slide. So you will be thinking that these domains are very easy and we will gonna pick. No, it's not like that. Okay, you think that, but it's not that easy. These things will comes after doing a lot of rehearsals and after doing a lot of practice. You know, after working with candidates preparing for OSCE, I have noticed something interesting. Most failures, those who couldn't make it, most failures are not because candidates don't know the medicines and they don't know the side effects of medicines or though they don't know the exact dose of the medicine. The most failure occur because candidates lose marks in predictable areas. No opening, no agenda setting, interrupting the patient while he is telling you his complaint. Okay, no repo building up, keeping a very hard facial expression entering into the station. No agenda there and keep on asking the repeated questions again and again. Once they have told you that I am having fever, then what's the use of asking in middle of the history when you are taking a past medical history and you ask, do you suffer from fever? This is this is the thing. It means that you have not listened actively to the patient complaint. You haven't built the agenda. And coming in so much hurry, in so much fear of 10 minutes time will not they will not make the 10 minutes time. So much anxiety that they are doing the straight questions. They are doing the double barrel questions. They are repeating the questions again and again. So marks will lost in your first minute. Then eyes never addressed, very important. Examiner love this part. They never address the eyes. What are their ideas? What are the patient concerns, expectations? No. How many of us have completed a history and management plan without ever asking from the patient, what concerns you most? This is our daily routine. We don't ask from the patient, what is your concern? If some lady comes to you with the body aches and pain, you just take a quick history. Oh, there is nothing to be worried. Just take a paracetamol and or you will write a bundle of tests for her, and that's it. You have to ask the concern from the patient, what bothers her most of the time. Then she will tell you, my husband lives abroad. I lives alone with the family in which I am having a mother-in-law, which is very strict to me, etc., etc. Okay, so that's where the eyes is very important. Then monologue management plan. What is this? The candidate decides the plan and announces it to the patient. The patient become an observer, but the examiner wants a shared decision making. Okay, they don't want any kind of announcement. They want you to engage your patient in your decision. They want you to make a patient centered approach towards your decision, and that you will be, and this is the thing which I will going to inculcate in your mind in further 20 weeks, inshallah. No safety netting. This is one of the commonest reason candidates lose marks. The consultation ends with, I will prescribe this medicine and you have to take this medicine, BD, OD. Okay, and that's it. Consultation finished. No red flags, no follow-up mentioned, no safety netting. What are the side effects? You haven't told anything to the patient. And then patient goes home and if he got some rash on the body, if he got some stomach disturbance or bad mouth taste, then he will recall you and say, what a bad doctor I had today. That's why it is very important part of consultation. And they will never, and the patient will never comes back to your clinic again. That's why it is judged very ruthlessly in your exam. Okay, and then knowledge mode, not a consultation mode. What happens here? Candidates start talking to the examiner instead of talking to the patient. In your station, examiner will be sitting in a corner and you will be facing towards you, the patient. There is no need to interact with the examiner. Not even say hello, hi to the examiner. No need to say salam to the examiner. You have to assume as if he is not sitting there. You have to completely ignore the examiner. Okay, you have to deal with the patient as if you are dealing the patient in your own GP clinic, in your real life. Okay, and they start interacting with the patient in anxiety or whatever. I have seen candidates after doing examination explaining the examination to the examiner. Why? There is no need of it. You have done the exam, even you no need to uh, uh, tell to the patient that why I'm checking your knee or why I'm checking your chest. Just do it in your pace as you do it daily. No need to describe your examination even.
Oh,
Okay, so they sound like they are answering on AKT question rather than conducting a consultation. Then time mismanagement, most of us stuck here. Okay, they take a very long time in history taking. No time management. You have to build a skill here, how you have to divide your time, how much time you have to give to the patient to speak, how much time you have to give on your history, how much time you have to give on examination, and then summarize and then come to
आपकी
management.
गाड़ी में चल रही
What they do, what the most can you do? 7 minutes of history, 2 minutes of explanation, 1 minute of panic, station over, bell rings. All right, so that's not the thing. We will try a hard best to kill these things. And the good news is that every one of these problem is fixed. These are not knowledge deficits. These are consultation skills. Okay. And consultation skills improves with the deliberate practice and feedback rather than just talking about these mistakes. Okay. So let's see what happens in a real consultation. I need to pause here and I want volunteer from you. We are going to run a short mock station based on a very common primary care scenario in front of you. A 45-year-old woman presents with 3 weeks of low mood, fatigue, and poor sleep. Okay. And further information may emerge during the consultation. Okay, I want any one of you who can come up voluntarily and be a candidate who is entering into the station, and I will act as a patient and examiner too, and you people also be examiner. Let me change here. Any one of you can come up who can perform this station with me, uh, or I shall call myself from among my candidates, like who are the PGIFM candidates. Dr. Yoha is here, Dr. Vikram is here.
हाँ वो भी भेज दे, मुझे
Zarna.
डिटेल्स भेज दे, मैंने वो
Sorry.
कैसा करे और देखे क्या इशू है।
If you are not talking to me, then please mute your mic.
Assalamu alaikum,
Walaikum
Dr.
Assalam.
Sahar.
जी Dr.
Can
Jahazib.
I do this?
Yes, sure, why not? Okay, some of you start a stopwatch and put a time of 10 minutes or maybe 8 minutes. Okay, Dr. Zarnab Mazhar also wants to do. Okay, Dr. Zarnab, Dr. Jahazib has come first. So let's start. We will be having such a station in future. Don't worry.
Okay, ma'am, no problem. Thank you so
Just
much.
be a examiner. Watch every deficit. Maybe you want to write down, any one of you. Do write it down. Okay. And I will be a patient, and Dr. Jahanzeb will be the candidate who will be taking, who will be doing a consultation. A 45-year-old woman presents with 3 weeks of low mood, fatigue, and poor sleep. Okay, we need to switch on our videos. Yes, Dr. Jahanzeb. Please switch on your video.
One minute.
Ji. Somebody will tell me when the time starts. Dr. Zanab, you can manage the time, please. Take a stopwatch, or you can open a time in your mobile phone.
Okay, ma'am,
And
uh,
when
I will tell you when the
time is up. Okay?
consultation starts. Okay.
Yeah. And when it starts, then you have to tell me that time too.
Okay, ma'am.
Yes, Dr. Jahanzeb, are you ready?
Yes, I am ready.
Okay.
Hello, good evening. Good evening.
Good evening.
I am Dr. Jahazib. I am one of the GP seeing you today. How may I know your name?
I'm Miss Seema.
Okay, nice to meet you, Seema.
Thank you.
May I know what is your concern of your visit today?
Yeah, doctor, since few days, I'm not feeling like anything good in my in myself, and I'm tired all the time, and I'm not in myself in past few days. Even my sleep is disturbed too.
I'm very sorry to hear about that, Ms. Seema. But first of all, I want to make sure you that whatever we discuss today will be confidential and it will be between us, unless there will be a harm between to anyone or you. So Can you tell me more about this?
Yeah, actually, it's been like few months, and I was having a very hectic routine, and I have to I had multiple hospital visits, and I have to take my mother all the time to the hospital, and then I am a working lady as well, and I have to put a lot of effort in managing my home and my kids and my mother too. And now I feel like I'm having body pains all the time, and recently my sleep is also disturbed, and I'm tired all the time, and I don't know what's happening to me. I was a very active lady, and I go for gym and yoga and all that, but now I'm not feeling like all those things that I want to do, and I don't know what is this, doctor. Can you please help me in that?
Ms. Seema, I know I can understand that it's very difficult for you to cope up with these things, but we will try to manage your uh, problems, and
Yeah.
it will we will come out with a solution. So please, Mr. Seema, tell me that since how long you are having this problem?
I have already told you, like it's been a month or 3 weeks. Yeah. Yeah.
Anything which any incident which has started this, anything which has started this problem
Uh,
in your life?
I don't know. There is no such incident. Yeah. I don't remember. I don't recall any kind of incident.
Okay. Any change in your work or at your home or in your daily life?
Yeah, that's I have told you that I'm just like not taking interest in the things going in my home, and once I was like a good active lady. I go to gym and I go for yoga, but now I'm not feeling doing that. I'm not feeling good in
Okay.
doing that.
Yeah. It means it is affecting your life also.
Yes, I feel fatigue, I feel exhausted. Yeah.
Mhm. Any specific situation in these 3 weeks which happened to you before three
In
weeks?
these 3 weeks, no.
Before 3 weeks,
Specific situation means,
any incident, trauma like this?
no, I have told you there is no such incident. It's just started. I don't know why.
Hmm. And what are you enjoying things before you enjoy doing things?
No, I told you that I was a good active lady. I enjoy gym and I enjoy yoga, but I don't want to go that them there anymore. And whenever kids start shouting at home, I just get so much irritated. Yes, sleep is also
Any
disturbed.
Okay, that's very. I can understand the problem. And what about your sleep and appetite? Is it same or
My sleep
changed?
is disturbed, I told you, and appetite is fine.
Okay. Have you ever think about harming yourself or any other person?
No, no, no. Harming means,
Any attempt before?
no, 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 not at all.
Any thinking of suicide
No, doctor,
before or currently?
no.
Okay. Uh, do you see, hear, or listen anything which do not do?
Sorry?
Do you see, hear, or listen anything or any voice which others people don't?
No, no, nothing like that.
Okay. And any other do you think that I'm asking you something different questions, but these are typical ones like do you do you think that somebody's want to harm you, or want to put something
No,
in
there is nothing. There is
your
no
thoughts?
fear. There is no such fear in me, and no, that's not the thing.
Mm. Any guilt you have
No,
about anything? Okay.
no, doctor, nothing
Uh,
like that.
what is your home situation? Who do you live with?
I live with my mother and my two kids, and I got separation from my husband 5 years back, and since then I am taking care of my kids.
Okay. I can understand that it's difficult with a single parent,
Thank
and
you.
but you are trying your best. And what is your work situation?
I used to do work from home. I left my job and now I've started a new job and I do work from home. That's going fine. There is no problem in that.
Okay, that's good. And what do you think that what is causing you this problem?
Uh, I don't think anything. That's why I'm here.
And what do you expect from this consultation? That
I just want you to I just want you to give me a solution of it, and I just want if I need any medicine, if there's any need of any medicine that I could start, and I just want to be live like I was before. That's the that's why I'm here, and I just
okay,
want to rule that out. Yeah.
we we will definitely will try our best. And one some few questions more. That do you smoke or drink alcohol or
No,
take any
no,
drugs or
no, not
medicine?
at all, not at all.
Any weather preference you have?
Uh, any?
Like you want cold weather or hot
Uh,
weather more? You
uh,
like hot weather or cold weather?
no, nothing like that.
Mhm. Any chronic illness you have, like diabetes, hypertension,
No, nothing like that.
or
I'm not have any chronic illness.
and do you perform any uh, relaxation technique or uh, like yoga? Have you interested in yoga or relaxation techniques
I
or
have
use
been
these things?
mm, I had been doing this, but I have left all these things because I lost all the interest in doing these things. So no, nowadays I'm not doing anything like that.
Okay. Uh, and these things happened before, or this is the first time you had
This is the
this
first time,
situation?
like past 3 weeks. Okay,
This mood problems have happened to you before, or this is the first time,
how much
or
time left,
any
Dr.
relation
Zanna?
with season?
Ma'am, sorry to interrupt, but only 20 seconds are left.
20 seconds. Okay, just sum it up now. Thank you so much, Dr. Jahazir. You did very well,
Okay.
and you are not leaving me in the history. Okay, that's very good. Okay, but okay, first of all, I want you people to be examiner. Yes, please open your mics, unmute your mics, and uh, judge this consultation. Be examiner. Yes, Dr. Zarna, starting with you from you. What do you think? What was the lacking, and what do you think? What was the what could be done to do more better, or anything? Any suggestion from you as examiner? I have told you many things. What examiner thinks and thinks or not.
Ma'am, first of all, Dr. Jahazeb has done a very good job
Yes.
because if I was given this chance, I would have never, you know, spent 10 more whole minutes because I really don't have any idea. But what I felt was that some of the questions were repetitive and maybe as the session started, you as a patient stated some of the complaints uh, that were very straightforward, and those were repeated again and again and asked again and again. So if the session and the questioning was straightforward, and also I also noticed that the history was taken for very long time. We couldn't reach to the management point, and the further, you know, uh, the more associated factors were not asked. I might be wrong because it's my first time.
Yeah, it's just we are just doing for the sake to make it more live and so that we can have an idea. This is not your exam, okay? So yes, anyone else who want to give some point on this consultation?
He missed in the past medical history of psychological illnesses and menstrual history, and he forgot to ask any medication she's taking.
Okay, anything else he missed?
Madam, ice was important. He didn't touch it properly. Ice, that was important.
Yeah.
Ideas, concerns.
Yes, Dr. Jahazir. Ideas, concern, and expectation. You have to be very clear in that. I know you were asking me, is there anything which is, you have took some words like that that you want to explore. Any incident happen, no, this is not the words. Okay, your words should be very clear. Is there anything specifically bothering you beside your complaint? Okay, you ask the expectation. Dr. Jahanzeb asked the expectation, Dr. Vikram, that what are you hoping from today's consultation, but ideas were not asked, and concern was very much important. And active listening, from the part of active listening, I told you in the very
What
beginning.
is the difference between, sorry, what is the difference between ideas and concern? Though
Ideas,
both look same.
concern is that something is in the mind which patient cannot express in the word, and you have to grab that thing. Okay, this is an idea, is the thing that what you think that what it could be. In some situation patient is giving you a very vague kind of complaints, especially if the patient comes up with you with depression and with chronic fatigue syndromes and with fibromyalgias. In those stations they are not having any single complaint, they are having a multiple complaint and a list of complaints. Then you have to ask the patient, okay, Miss Seema, what do you think what it could be? Okay, then she can say that I think I have got a cancer. Okay, then there you have to, then your management plan will be converted into a counseling station. All right. And I have told you in the beginning that I was very fine previously, but past few months I used to take my mother to the hospital multiple times. You haven't asked me why you were taking your mother to the hospital. Then I will tell you that recently my mother diagnosed with a cancer, and I'm the only one who is looking after her. That was my concern. Okay, so there's always a hidden agenda, and you have to dig that out. This is the game. Okay, and this is the thing which will be built by doing a lot of practice and everything. I've told you that they're judging the consultation. Okay, they are not judging that you have touched each and every point of the history. All right. Yes, anyone else want to speak here? The patient who were sitting there in your exam was totally unpredictable. They are very bad actor. They were, if the patient is of if the station is of depression, they will not look like a depression, because they are SPs, they are just acting. Some are very good actors, but most of them are very bad actors. Okay, so you have
But
to.
in depression, patient usually less talkative,
Yeah,
but you are talking more,
this
and
is this is the idea.
and
But in
face look also gloomy.
yeah, you are right. But I told you
Right.
they are very bad actor. Some are good actors and some are bad actors. So if this is your luck, if you get a good actor or a bad actor, okay. All right. Let me share the screen once again. Very well done, Dr. Jahazib. Don't get disappointed. This is just a part of the webinar, and this is just
It's
to make you interactive and make this webinar interactive. Okay. So
Thank you so much. Actually, I was unprepared. Suddenly,
no,
I
no, don't take it to your heart. It is just a part of learning, and we are all here to learn and to grow. Okay, don't worry. We will be working on
thank you.
this in the further sessions. Okay. So opening and repo building in this scenario was good. Dr. Jahanzeb came in and they introduced himself, but you have to keep a slight smile on your face. Okay, that is a good entrance. You have to be very gentle and very kind. Don't make hard faces. Okay, this is in your daily practice. You see patient, you have a little smile on your face. Okay, you are not sitting in a tensed face. All right. So this is again a part of your personality and your rapport building. He introduced his name very well and uh, started conversation with the patient. Okay, eliciting eyes was missing. Eyes were not properly checked. Okay, psychosocial context in this is it's a actually it's a term of biopsychosocial model. Okay, in this he was asking that if we how you are feeling at home, and he asked that things. Okay, so we will be going to work on this as well. Biopsychosocial model is a very favorite thing in OSCE and for examiners too. They want in every patient where the examination is not required, they will put any kind of psychological factor. In this patient, she was depressed because the illness of the mother who is recently diagnosed with a cancer. Okay, then Dr. Jahanzeb candidate has asked that is anything disturbing your life? This is the good point. He asked it. Okay, so you have to if he asked the concerns, I would have been told him that my mother recently got cancer and all that, and I'm so much depressed because of that. So then he will ask, is there anything? Does these things causing impact on your life? Though he have asked from other side, but then you have to link this biopsychosocial model. Okay, and then you have to jump to the management part, and you have to tell the all non-pharmacological measures for depression, and then pharmacological measures, and then you will say you must go for yoga and gym and just start from 5 minutes and all that. We will doing these station uh, in our sessions, in our regular sessions. Okay, the risk assessment, Dr. Jahazib asked it, any self-harm attempt of any self-harm, any suicidal thoughts, very important, very good. Okay, then shared management plan. If you think that you are now stuck in the history and you want to move on, then don't try to move on the history. Try to jump on the other parts of the station, like management part. Summarize up it all, tell the patient in less than 1 minute that you have told me this. Now from this consultation till now, I have noticed that you are feeling this. Now I'm going to tell you no, what you are doing. I will prescribe some medicine, but before prescribing you medicine, I want to give you some advice. Is that okay with you? Are you with me, Miss Seema? Okay, so this is how you are going to start your shared management plan. Okay, then safety netting, I have told you. when you are if you are writing SSRI for this patient and you have told everything, then you have to say you have to come back to me in 15 days time, and you have to tell all the side effects and all those things and follow plan. If there is anything necessary you want to discuss with me, our clinic number is written there, our hospital number is on the file, you can call me anytime. Okay, so this is how you will have to sum up the station. Okay, Dr. Jhazev or the candidate just stuck to the history. There are other parts too. There are management parts too. Okay, so if you think that there's nothing to ask more, then just go ahead.
So what will be the diagnosis? Adjustment disorder or depression?
No, it was it was a depression because of
But
the
4 months not finished. 4 weeks time not finished. 4 weeks.
it doesn't matter. If the patient is depressed, mood is low, not taking interest in daily life, then you can deal it as a depression. Then again, you are stuck in the diagnosis. I told you, don't worry about the diagnosis. Patient, your examiner is not interested in your diagnosis, or a 4 week time has passed or 6 months has been passed. They are not interested in that. They will be interested how nicely you are going to finish it and how nicely you are going to address the eyes and biopsychosocial model of the patient. You have to make the patient back to her life. Okay, your diagnosis will not be judged. Okay, I can understand that for completing a station, diagnosis is necessary. That's why you will give a proper medication. It's okay. But let me tell you, if you miss the diagnosis, you will not lose the mass. But if you miss addressing eyes and psychosocial context and other closing the station in within 10 minutes, if you miss that, you will lose marks. That's important. Okay, and how we will do that? In PGIFM OSCE batch, in further 20 sessions, which will be run for 20 weeks, we will be doing these mocks again and again, so that these things will inculcate in our mind, these skills will be developed, and once the skill is developed, your brain is you don't need your brain to process from zero. Okay, your skill will develop and you will start doing these things on your own. Okay, so in PGIFM OSCE batch, we will be providing 20 sessions for further 20 weeks till November 16, or I think 15 or 16, then your exam is, and it will be all Zoom interactive session that I have showed you. Okay, so that you can join us from anywhere. Okay, and each session will include mock station, either 2, 3, as much as we can do in 1.5 or 1 hour, we can do that. Okay, then I will give you a structured debriefing, which is the actual OSCE criteria where you have been judged, and I will share that with you in your chat boxes or via WhatsApp. Okay, live also I will give you the feedback, and then I will share that with you. So it is a kind of a written feedback. Then progress tracking, session recordings will be there. You can access that recordings. You can do that rehearsals many times at home. Okay, I will task you the topics. You should prepare well when coming into the next session. Okay. And there will be a focus.
Doctor sir, there is any distribution of OSCE station between medicine or gynae, peds, psychiatry,
Let's have
or
a
just
question
random?
answer. I will start a question answer. Just give me a few minutes. I'm going to sum this up. Okay. We will have a question answer session. Just give me a few minutes. Okay, so you have to be interactive. You have to prepare with someone with you. The biggest difference between preparing alone and preparing with feedback is that somebody is actually observing your consultation and identifying the marks you are losing. So that's why a badge is a very good thing sitting in front of everyone will decrease your anxiety as well, and it will boost your confidence for the exam. So this is our enrollment plan. Okay, June 30, I have chosen myself to stop the enrollment. 5 enrollments I've already got, and I just need 5 to 6 more, because I'm not going to take more than 10 or 12 students. Okay, so that I have to be interactive with them, and we can do mock stations. All right, and the feedback I have to give, so that is practical for me. I don't want to take 50 students and then no mock stations between them. Okay, so just I will take only 10 to 12 students probably. The purpose of the program is simple: to provide the structured practice and the feedback that make candidates struggle to obtain when preparing alone. Okay, so this is the purpose. A WhatsApp number is there. If you want to know anything further, you can ask. Yes, Dr. Jahaziv, what were you asking? Please ask me again.
Sorry, I was asking that any distribution of OSCE station between
Yes.
medicine,
Yes,
psychiatry.
there is always a distribution. You will be having 2 to 3 stations from medicine side, one from surgical side. There will be 14 stations. Okay, and 2 to 3 will be the resting stations. And then you will be having medicine station. You will be having one surgical station, one gynae station, one peds station, one consultation station. Okay, so that's how it is distributed.
Any instruments they will ask for?
No need to take any instruments with you. Everything will be provided there.
No instrument session, instrument station.
No instrument checking session that they want to check your knowledge on instruments. That's what you are asking, no? No, there is no.
Yes.
There is no station like that.
And any physical examination station?
Yes, of course. After one station is off without physical examination, and one is physical examination. Okay, so this is how they distribute. If they are giving you 12 station, then 6 station is of physical examination, and 6 of counseling or consultations.
No, 6 station will be complete physical examination, or history
They will provide you. They will give you a task. Okay, let's say if there is a patient with ACS, acute coronary syndrome, they will give you do a focused physical examination. Then you will be doing CVS examination.
Along with history.
Yes, of course. That's the part of physical examination is a part of your consultation. In some station, they will ask you. In some station, they will not ask you. And in those stations, please, no need to do physical examination. What candidates do after taking history, they start, okay, I want to examine you. No, there is no need of that. If it is not written in the task, no need to go to physical examination. No need to start physical examination. Am I clear?
And sometimes physical examination from the examiner. We can ask this we are not performing, just asking the findings of the patient.
No,
we can do like this.
No, you no need to interact with the examiner. Sorry, you no need to interact with the examiner. No need to ask any question. Even don't say hello, hi to the examiner.
Because I have given AMC2 before. There are some physical some examination we perform, and sometimes we have to ask from the examiner, physical examination from the examiner.
No need to ask that. Let me tell you once again, no need to ask that. Okay, whatever they want from you already written there. Just read the task carefully, please. Everybody, just read the task carefully. Whatever they have written, just do that. Okay, if the examination is not written, there is no need to do. If they write the exam, do a focus examination, then you have to do it. And there is no need to interact with the examiner. I have repeated this so many times. Okay, there is no need to interact with the examiner. Just think as if he is not sitting there. Yes.
If the task is perform focus examination like cuff cuff and respiratory system, we will perform the focus examination. Do we have to perform the general physical examination as well in the same patient? For number one thing. Number two thing,
Doctor,
sometimes we have to.
can you please, Dr. Aslam, please, it's very hard to listen you. Can you
Madam,
please speak a bit louder?
I, I want to ask if the question is that perform focus examination. Like patient is with cuff and I have to perform the focus examination. Do I
Yes,
have to perform the general physical examination
yes,
on the same
yes,
patient? That is
yes.
number one thing. Second question is that sometimes uh, uh, some tests are mandatory to perform, like DRE. Do we have to verbalize it before the examiner or before the patient?
Acha. Okay. No intimate examination is required from you. Okay. If any examination which causes, which causes harm to the patient, if they put DRE, then there are so many candidates, everybody will start doing DRE. That's impossible. Okay. So no need to do breast examination, no need to do DREs, no need to check blood pressure of the patient. Any examination which can cause, because they are not actual patient, this is not your long case like in other specialty. Okay, so this is not required from you. You can mention, I can send you for DRE, or if you want, if there is some station, then you can mention it, but you are not allowed to do that in exam. All right, any such examination is not required. And general physical examination, always better to start with general physical examination. In when you are sitting in your clinic and patient is in front of you, and you we some of us directly jump towards the chest. It's not a good idea. Okay, even in your sitting, even in your practical life, always start checking from general physical. Check the hands of the patient, check the anemia, clubbing, and then go up to the lymph nodes, and then you can check cyanosis, then you can check pallor. Okay, then you start chest examination. This is the good practice even in your daily life as well. And in exam, of course, you have to do general physical examination. And if the patient is of any cardiac station, like if the patient is of any acute coronary syndrome or something like that, and usually they provide vitals on your desk. Always check your desk that what you are provided with. Okay, so they have provided you everything, and then you will see the BP were written there, but you have to say, I will check your BP as well. Just check, just say, and move forward, move further. Okay, so general physical you have to do before starting the focus examination.
And what about
Thank you.
obstetric examination? Will they provide dummy or something like
No,
this?
no obstetric examination. Your station will be of gynae station. Okay, your station will be of gynae station, and in gynae station again, you are not allowed to examine the patient, and even in the task, it will not be written there. You just have to do the consultation.
If the station is history will with examination, then history should be cut short in that station. Should not some not eight should not be 8 minute history if the examination and history
Yes,
both
you
together.
have to. Yes, of course, time management. Time management is very important. We will be we will be learning this, and we will be practicing this, how to manage our time in further 20 sessions. This is time management. If you are having a task that the examination is required, then of course you have to be very precise. You have to be very quick. Not precise, you have to be very quick on history. And how you will be quick,
Madam, I
that will
have
be.
learned many things from today.
Sorry?
Madam, I have learned many things from today's session. The most important thing which I have learned today, whenever a candidate is being stuck in taking history, the important thing you told, you just summarize it and jump to the next session, next part of that conversation. like summarizing and
Yes,
getting
of course.
onward examination and safety rating onward.
Yes. Before
So,
moving to the
so
management part,
this
before moving to the management part, you have to summarize whatever you have gathered from the patient. Okay?
Hi, Dr. Sahar. Hello.
जी जी.
I'm Abdullah. I just passed my AKT in May.
Congratulations, Dr. Abdullah.
Thank you very much. Thank you. I'm planning to sit in November attempt. I really learned from your case that you have done with the case of depression. So
Thank
in
you.
case, back to the case actually, in case if the woman just told that, yes, sometimes I have the feeling of self-harming, but I didn't do that. I didn't have an intention, but it's something coming off on and off in my mind, number one. And secondly, if the same lady asking for sleeping pill for her insomnia, do we give her anything for short term? These two precise questions, please.
This is a kind of this is a separate mock station when the patient is having suicidal thoughts and asking a sleeping pill station, sleeping pills from the doctor. This is a kind of a counseling station. Okay, you know that, and you have done AKT as well, so you have seen in any disease, were there any disease there where you are allowed to write prescription, you are allowed to write sleeping pill? No?
No,
Then why you
I
are
said
going to?
short term, like 1 or 2
No.
weeks.
In which disease in your theory you were allowed to write for sleeping pills for short term?
So we have to counsel her that there
Yes,
are side
you
effects.
have to counsel her that this contains side effects, and let me tell you, it will cause dependency, and I cannot give you and with this sleeping pills, it will not treat you. Okay, so this is your counseling station. It will be your counseling station. Of course, patient will be in front of you and demanding. This is an unethical demand. This comes in these kind of counseling stations. Okay, so you have to counsel them. And still,
Right.
if they
This
are,
is unethical as well as very dangerous.
yes, you have to
Dangerous that
yes,
patient is suicidal thought and we prescribe this.
yes, and you have to counsel all these points to the patient, which you are telling right now. This is
Right.
just like you are dealing with such patient in your daily practice. Okay, this is nothing else from that.
So both of the points, if being raised, then we need to counsel the patient.
Yes,
Now,
you have to counsel the patient. And then
regarding your
there
course,
are SPs,
sure.
they have been, if you reached all the points of counseling in that patient, then patient will divert from there. Okay, because they are also acting now, so they will tell you that, okay, doctor, fine, I will do whatever you say and all that.
Right.
They're
Thank you.
they are sitting examiners and patients, SPs are sitting there to pass you, not to fail you. Okay, they will just check if the doctor has reached all the points, it will be over.
That's reassuring. Okay. Regarding the course material, you mentioned that the materials will be provided. What kind of materials in your
That is
course?
a separate discussion. Okay, that was a separate discussion. You can ask because it's a very a separate presentation on a course detail or what kind of station we will be having and all that. It will take a 1 hour or so. But that I will give to those who will join.
Yeah, of course. For the registered candidate, I'm asking.
Yes, for
what kind of materials?
registration, I will. You all can ask in the group. I have made a group now, so you can ask in the group, and we will be providing you each and every detail. Our team is very active, and they will give you each and every information on that. No problem. Ask anything, anything. Don't hesitate in the group, and even if you want to do me a private message to me, to my team, we are try to be responsive most of the time, and sometimes there are some job constraints and all that, so we will be a bit late, but we will respond. Okay.
Sure.
I
Thank
think
you.
now we should sum this up. Thank you so much for. Is there any other question? Or if you want to discuss anything later on, just give me a text. No problem in that. Okay. I have made a
Madam, how
group.
many stations have to be passed?
All station you have to pass. Okay.
Oh,
But to be very honest, I used to tell my participant that you have to pass all the stations. But if you want to know exactly, then if you fail, God forbid, if some of the candidates fail 2 to 3 station, then still you can pass. Okay, so if you fail, if some of the candidates will fail in 2 station or 3 station, if it means that if 2 to 3 station goes bad, don't get disappointed, don't get anxious, you will still have a very big margin to pass. Okay.
how many
Okay.
stations are there?
They used to keep 14 stations, and there
Okay.
will be 2 to 3 resting stations. Yes, and 10 minutes will be
Uh,
given to you.
Dr. Sahar, you tell us that there will be 20 sessions and each session will be 2 mock stations discussed.
That
So
was a
40 scenarios will be enough for the exam
that
to
is
pass.
a rough number. Maybe we, if we do very well, there is a if like we sum up, 10 minutes we have to give, na, so we can do more than 2 if you are going very good, and that's why I have keep a badge of 10 to 12 candidates, not more than that, so that everybody can get chance to mock the station. Okay, so that was just a number, so it could be 5, it could be 2, it could be 3, depending on the situation, how nicely we are going, and how much we are stuck, because we cannot run the class for more than 1.5 hour. Okay, so it is not necessary that in every station
Madam,
we
one
will be
question.
dealing with two stations. It can be 4.
Madam, one last question.
Yes,
Sometimes
yes.
the task is very grey, not mentioned whether we have to perform the examination or not after taking detailed history. So, how to deal that grey session? We have to perform or not, or we have to ask from the examiner.
You don't need to ask anything from the examiner. Whatever the examination is required to perform, it will be written in the task. If it is not written,
No,
don't perform.
sometimes grey, sometimes very grey, not mentioned even to perform or not to perform.
No, it is not
Sometimes
mentioned.
very grey.
Sorry, I couldn't. Maybe I am not getting your question, Dr. Aslam.
Sometimes the task is very great. It's not mentioned whether we have to perform or not. So how to deal it?
Look, if no, if you are saying that if it is not written that you have not, you are not, you don't have to perform, and you want to perform the examination.
No, it's not mentioned whether we have to. It is not exam. Madam, I want to ask. The stations are sometimes very great. It is not written whether we have to perform the examination or not. So how to
Then
deal
you
that
don't need to
condition?
perform. If it is
Right,
not written,
right,
then you
right,
don't need to perform.
right, right.
Okay, and if still I'm not clear, then you can test me separately. Okay, maybe I'm not getting it because your voice is so much low that I cannot hear.
I think he's asking that if it is not mentioned in the station that we have to perform examination or not, then what should we do? We
Then
will
you,
do examination. Or not?
no, no, no need to do.
Okay. If I
Whenever
mean,
they
it
want,
means if they will say that we have to perform, then we will do examination. Otherwise, no need to do examination.
yes, examiner will not tell you anything. Whatever they want from you will be written in the task. Okay, the task can be very brief as like a for 20 years girl come to your GP and she has some concern regarding the health, proceed with the consultation. That brief task can be there. Okay, if they have not mentioned that do the focus examination, then you don't need to do the focus examination. They will not challenge you. If they want examination, if they want to perform, if you want you to perform the examination, they will write in the task. If it is not written in the task, then there is no need to perform and no need to ask from the examiner even. Am I clear? And there is no doubt in it.
Right, madam. Right. We are working as a GP. So what would be the reference criteria regarding the patient consultation? Even we know the management of specialists. So should we proceed with the specialist management or we have to refer the patient? So what would be the reference criteria? Kindly brief.
Yes, of course. Referral criteria is all the same you have performed in the AKT. Where there is need of any referral, you have to refer. If there is need in the station to refer, like if you are having appendicitis in the station, you have to do all the consultation. You have to call the ambulance. I am going to refer you to the hospital. There, the surgeon will be there. They will going to look after you. That's it. If your patient, if you are having a station of atrial fibrillation, I'm going to refer you to the emergency. Whatever you have learned from the AKT, whatever the referral criteria is there, you have to apply the same on the patient right now. Okay.
Thank you, madam. Thank you, madam.
Okay, thank you everyone for joining today's OSCE orientation session. I hope this have given you a clear understanding of what examiners are actually looking for and where candidates commonly lose marks. Okay, we will be looking forward for your enrollments. Okay, and inshallah, in further sessions, we will do all these mock station which is in your mind and what could happen in this scenario, what could happen in this scenario. We will be practicing all that. Okay, thank you so much for tonight's session. Take care, everyone. Good night.
Thank you.
And
Thank you.
okay. If there's any question,
Thank
you
you,
can
Dr.
write
Saib.
into the message. You can message me. You can write in the WhatsApp group. Whatever suits you. Okay. Thank you so much. Good night.
Thank you.
Thank you.